My main goal was to be able to provide a place where we had better affordability and show that, if we're there to serve the fertility community, we really need to be thinking about how we can lower cost. And that is not a particularly popular idea because, there is a lot of equipment, really highly specialized expertise, skill set that you need. So kind of the cost of running an IVF program is actually quite a bit. And so, I always say, how are we doing this? Well, we're doing it by making sure that we're providing really efficient care, which I think is also what patients want as well. And what I mean by efficiency is that instead of doing, let's say, 6 ultrasounds for an IVF cycle, we can get the same quality care with maybe 3. So it's not skimping, but it's still making sure that we are able to kind of help support both not only kind of a lower cost, but also sustain the clinic. Because that is the question that I get asked all the time. How are you being able to provide better affordability for patients and still kind of manage to support a clinic? The affordability piece is so important to me because I am heartbroken every single time I have to see a patient realize that their chances of fertility are actually quite good if they could afford the treatment, but they can't. And so there is, and part of it is because there's a challenge of fertility care not being covered by insurance. So this is very much so kind of a multi-pronged effort for patient advocacy. So all the mandated states, meaning that the states have said that fertility care has to be mandated and be covered under health insurance plans, and we happen to be one that is not that, So this is going to be kind of a long-term team approach of better affordability if someone does not have fertility coverage with their insurance, right? That's what we consider someone who is paying for all of it out of pocket. And then also working with many different groups to kind of help increase access through insurance. And we certainly have made a lot of headway. And when I say we, I mean the collective we of everyone who is part of fertility in the United States. A key component of better affordability for fertility care is also the idea of providing price transparency, because historically have been what patients feel like is surprise billing, which is really stressful when you're going through something that's so difficult and you've budgeted for a certain amount and then all of a sudden you see that it's beyond that and there's extra services that are adding up. So at Arbor Fertility, we believe 100% in price transparency. You can go to our website, and we always encourage you to, and look to see exactly what the cost is. I'm really proud of our team is that we do a lot of market research to stick by our mission and make sure that we are well below kind of our general different costs in the area. And that is something that we want to stick to. When someone contacts us at Arbor Fertility, and they can do that through our website, they can self-schedule an appointment, and they can also call our care team. They'll get a lot of information. Initially, I'm happy to meet with someone in person if they would like, but we have also lots of really virtual or telehealth benefits, which are great, and we're still able to convey the same information. So generally the first step is talking to me, and we want to make sure it's just simply a time to chat. So there usually isn't really any testing that we have to do that. During that visit, I'll talk through our mission, I'll talk through the basic components of testing, and then I'll generally talk through based on, after we go through those test results, what would be kind of the best tailored treatment for a person, patient, couple. And from there, we usually do a follow-up to review that testing, and then there's kind of 2 types of treatment that I'll walk someone through overall. So a lot of that first visit is information gathering. This is a pretty vulnerable moment, and so you want to feel like the physician that you're speaking to will understand you and respects your story and really is listening. And I think that is important overall, just to make sure that you feel in control of your journey, because there's so much about this that feels very out of control overall. And so it's meant to be empowering. It's not meant to be, oh, the doctor saying we need to do this and we have to. It's meant, I view my role as to be a counselor and, an expert counselor, but, I'll say we could do this. We could do this option as well. These are my recommendations. These are the pros of this treatment, and these are the pros of this treatment, and let's kind of decide together. So if you're wondering what fertility testing entails, it's actually pretty simple. And if you're also wondering when you should seek help from a reproductive endocrinologist, it's generally based on time. So I'm happy to see folks who just want to make sure they have all the right information before they attempt conception, and that's perfectly fine, and just can do fertility testing then. Fertility testing is usually about 3 parts. And we kind of divide it into kind of what's needed for the female and what's needed for the male, although we see all sorts of different couples, so that kind of model is not always there, right? But if it's a heterosexual couple, we usually do blood work to check their hormones and an ultrasound to kind of check their anatomy of the uterus, the ovaries, and then a specialized test for the fallopian tube. That's 1, 2 on the female side. On the male side, we do a semen analysis. And so that is to check to make sure that the counts, concentration, all of that with the sperm look great. What I'm really thrilled with is that we've partnered with companies that provide more direct to consumer testing, so they can have some of this testing from home, so to speak. Now the blood work, we'll usually send you to a lab. An ultrasound, generally one of our team members or myself will perform that. And it's nice because I can talk you through it in real time. The semen analysis, we've partnered with a company where we can actually do that from home. So a lot of guys really like that because it's kind of awkward to collect in a medical clinic. And so they can collect at home, and that gets shipped through our regular kind of mail carrier, and they get a really high quality semen analysis report. And so it's much more consumer friendly, which is awesome. That is certainly an advancement that we've seen over the last couple